Next is the client-centered therapy. Here we have Carl Rogers, an American psychologist, and this client-centered therapy was founded in 1940s. So Carl Rogers doesn't want to have a term patient because for him, patients are the one who acknowledges that they are sick and they need doctors, they need an ultimate um help, but rather client just needs assistance. So Carl Rogers wants to change the term patient into client. That's why it is called as client centered therapy. So it was originally known as non-directive counseling or non-directive therapy. So client or those people who seeks help will go to your clinic or will go to your office and will ask help. But part of this client-centered therapy is you will not direct them of what they need to do. You are just there as a listener and as a sponge or absorber. Okay? You just need to absorb the negative vibes that they are expressing. Okay? Most of the people, or there are some people who just needs listener, someone who will not judge them, someone who will not contradict them, but just empathize and listen and be an outlet for their relief. So this is the purpose of client-centered therapy. For you to be empathetic, to absorb all the negative energies that this person is expressing. For example, as an educator, our colleague is always telling us negative things. She's always expressing negative vibes. At first, maaasar ka, maiinis ka. Ano ba to? Lagi na lang problema kinikwento nito. But in a client-centered perspective, it's okay because she is releasing negative energies and you are helping her or him to be relieved. Nakakapag-express siya eh. When someone is expressing, meaning to say they are relieving their excess baggage in their internal thoughts and their internal being. So just listen, just empathize, okay, and do not contradict. That's why this is a non-directive counseling. It is an orderly process of client self-discovery. You will assess the person. Sorry, you will assist the person. Okay. For example, the person is keep on telling his or her problem during pandemic. He's having a problem with relationship or having a problem with his job. Just listen, then ask. Now you know the problem. What do you think in your own perspective? What will be your possible result that you think will be possible? So it will lead to self-discovery. You will just listen, you will assist them, you will be a guide. Oh, okay, that's your problem. All right, that's your problem. What do you think will be the resolution for a problem? Can you tell me some stories of your thoughts? Or tell me what are you thinking for the possible solution for a problem so you could eradicate or you could eliminate those negative emotions. So the person will tell some possible resolution for his problem. Then you will guide again. Do you think the resolution that you have mentioned is helpful for you? If you will say yes, it will be helpful, then that's it. Tell the person, okay, so since that will be helpful for you, why don't you try to do that resolution? So the resolution or um The solution for the problem is not coming from you, it's coming from them. You just guided them all a way long to come up with their solution. But before coming to a solution, made it sure that he or she realized what's the problem. He or she is expressing the problems to you, the dilemmas, the challenges, and then guide them towards the resolution. Okay? But then again, at first, you need to be patient in terms of hearing their stories. Because the purpose of this client centered is you will be a sponge, an absorber of their negative vibes, and you need to be ready and prepared. Because if you want to do this kind of therapy or this kind of technique, you will encounter different problems from different people, and it will affect you. If you are a weak person, I do not recommend this client centered therapy because you will hear a lot of negative vibes and you will absorb these negative vibes. But do not embody or do not retain these negative vibes to you. Once you have listened to these negative vibes, do not retain that in your heart and in your emotion. You're just doing your job as a sponge. You absorb it and then you need to throw it away again just for you not to be affected with their condition. Once you have listened to a lot of negative things, you will be affected. But then again, you need to throw it. The client resolves conflicts, reorganizes values and approaches to life. So it could be interpreted as a guidance of their thoughts and feelings. What are your thoughts? What do you feel? You will tell to the student. For example, the students needs help. What are your thoughts now? What do you feel right now? So the student will tell some stories, will express the thoughts and feelings, and you will ask what would be the possible resolution for a problem that you think that you could do. So that will be the resolution. So the techniques, you need to be genuine and congruent. You need to be really truthful to yourself. So allowing them to share their thoughts and feelings. If they feel that if you're genuine, if you're true to your statement that you want to listen, just listen. So make an eye contact, make them feel that you're really genuine in terms of listening with them. Next is the unconditional positive regards. So this means that you're being more an empathic person. You are allowing yourself to put yourself in their own situation. You are imagining yourself that what if I am the one facing that situation, so that you could relate to the person and you could totally guide them. Next is the empathetic understanding. Of course, a really good empathy is needed for this technique. Without understanding their situation, you cannot have this empathy. If they cried, so you need to cry as well because you're really touched. Remember that the empathy is the epitome of um, of a support, and it's an epitome of comfort. All they want to have is someone who will understand them and be empathetic with them. So these are the techniques that you need to have for you to have a client-centered therapy. As a nutshell, Gestalt therapy will teach the students or will teach you as an educator to live in reality, to live in your current state. The other one is for existential psychotherapy. Existential psychotherapy, you need to bring what's your purpose in essence in life. And the last one is the client-centered therapy, wherein you need to be an absorber of the negative energy coming from different person. So you could be a great help in terms of relieving their stress, anxiety, and depression. So that's it. Thank you so much for listening. Do you have any questions?